Hello and welcome everybody to another episode of Ask a STEM Star. Here today with me is me, obviously, so Ami Bakare. And then we also have the other half of STEM Stars, which is Bandu Bayan, Dr. Bandu. And we also have with us a special guest this week, Chelsea Sumner. Um, Yay! So
Hi.
Chelsea has an exciting journey that we cannot wait to hear more about, and her background as a pharmacist. So, Chelsea, if you want to just give us a little bit of an introduction for yourself, that'd be awesome.
Yeah, I can definitely do that. And I just want to start off. Thank you both so much for asking me to be on the show. Super excited to be here. And like just super pumped to have this opportunity to share kind of my journey and my background. So, like Ami said, my name is Chelsea Sumner. I am a pharmacist by training. Went to school and got my undergraduate degree in clinical research, which is kind of a weird. People are like, oh my gosh, you got a degree in clinical research? What does that mean? Um, like, really, I decided that I enjoyed benchtop research and being in a lab, but I actually liked people better. And so I did my degree in clinical research with a double minor in Spanish and biology before going straight into pharmacy school to get my doctorate of pharmacy at UNC. And then decided I love patients. But while I love patients, I can have an indirect impact. And so I decided to do a non-traditional move into the pharmaceutical industry and moved into pharma. So joined Eli Lilly and Company a year ago through a postdoctoral program, and I've been here ever since.
Wonderful. Thank you. That's an awesome background. So, I think it's interesting that you say that you majored in clinical research. So,
Mhm.
how did you decide to pick that as a major?
Yeah, so that's a really great question, and people are tell me more. So I kind of figured out that I want to be a pharmacist at 16, and really I was introduced to kind of STEM through a program called North Carolina Project Seed. So originally born and raised in North Carolina, and the program is amazing. Literally, I spent 2 summers doing analytical electrochemistry research at North Carolina State University, and that really was kind of like my introduction to all the things that you can do in STEM. So on Saturdays, my junior and senior year of high school, I spent learning about all the careers in STEM.
Nice.
So it's not what you typically would think of for your teenage years of high school, but that's how I spent mine. I was introduced to a phenomenal woman by the name of Carla White Harris, and she was a pharmacist, and she talked to me about all the different things that she could do with her degree. And so that was kind of my introduction to pharmacy. And when I was applying for schools, I looked at what pharmacy schools were in North Carolina and that I could go to school for free. And I actually went to a smaller private school, not as big or popular, but they had a pharmacy school. And so they offered 2 pharmacy majors. One was pharmaceutical sciences, and then the other one was clinical research. And so, having had the experience from Project Seed and doing benchtop research, I knew that I enjoyed it. I did microbiology research as well while I was in undergrad, and really kind of got my hands dirty in the lab, looking at samples and, like literally spending hours and hours of time in the lab. Which did not leave me a lot of time to socialize. So, as a people person or self-proclaimed people person, I wanted the opportunity to interact more with people and have the kind of indirect effect on research. And so clinical research was the option for me. And so I decided to major in clinical research, learn more about clinical trials. It's an area in which there's not a lot of people that look like us. And how do we get more people who look like us into clinical trials so that we actually know how medicines affect us, and then have that impact? So I really wanted to understand more holistically what it means to really take care of patients, knowing that I wanted to be a pharmacist, and that's a piece of it. So that was kind of all the factors that went into me wanting to go into clinical research.
Awesome. So that's super moving to hear because I was a Project Seed scholar back in the day. So I did, research in high school too. It really does
Love it.
life. So I think that's always awesome to hear how that exposure when you're relatively young and still trying to figure out a path can really steer you in a certain direction. So I want to ask you a little bit more about kind of the early stages. How critical do you think it was as far as interacting with the female pharmacists that you met early on, and you really choosing that path? Was it just having that mentorship and having that exposure, or was there something else that kind of was the switch that kind of led you down that path?
That's such a great question. I definitely think it was pivotal. She's still my mentor today. I was home recently in North Carolina, and we got lunch together. So it's now been a 10-year kind of mentorship. So she brought me into pharmacy literally 10 years ago. And so we catch up really frequently. And I think it was so important because at that time, my mom forced me into the program. It was not something I would have voluntarily signed up for my summers because it literally started the week after school ended and literally ended right when school started. So I'll never forget, they made me sign up for the paperwork and they're like, okay, this is how you're going to spend your summers. And at that point in time, I was 15. So I was really like, okay, well, I do really well in school, really well in math and science. Everyone says be a doctor. Well, there's got to be something else out there besides being a doctor because I don't want to go to school for that long. So what can I do? Like, what are the opportunities that are available for me? And unfortunately, for gifted African American and Black women, you are kind of just pushed to, okay, you're smart, go be a doctor. And no one ever really gives you any guidance for like really what you can do. And then they send you on this path of, oh, I have to be a doctor and I have to achieve this goal, and not knowing that there are so many avenues to get that doctor in front of your name, that elusive doctor. And so it was really like, okay, I know that I want to do something. I want to impact people, but I don't know what that looks like. And so that program really, really opened my eyes up to, hey, that we spent a summer at, not a summer, we spent a weekend at University of Maryland, Baltimore County, UMBC, because they had the highest number of African American and Black doctorates that come out of the school. And so I'll never forget meeting their president, Dr. Freeman Rabowski, and it's like he's a phenomenal example of, you know, what you can do and how you can achieve, and people that look like you really excelling. And that was my first example of seeing that. And not just as a physician, there's nothing wrong with becoming a physician. I think that's a great thing. We need more people that look like us that are who are NDs, DOs, PAs, NPs, like the PTs, the list goes on and on. But I have friends who are biomechanical engineers who have their PhD. I have friends who literally are nuclear physicists. So, you know, literally we span the gamut and just can do anything. But if you don't get that exposure earlier on, you don't even think to dream big enough. So I think that was pivotal for me in knowing that there's a world out there that we're not exposed to, that literally can span your interest. So both of my brothers went to the program. My middle brother was a biology major, and then he was like, yeah, I'm gonna be a lawyer. So he became a lawyer. But my younger brother is getting his PhD in computer science. And I think that's a huge, like a pivotal reason as to why he even thought about it. It's like he didn't even think about it. And Project Seed exposed him to the fact that, hey, you spend a lot of time playing video games. You can do something with this. Make it, yeah. So make it profitable for you. So it's pivotal.
Nice. That is awesome that you were able to get, honestly, I think the part that's really interesting to me is that you were able to get a mentor so early on, like, because not everybody is as lucky to have somebody earlier on in their, educational path, that somebody can actually like steer them into a certain direction. So that was awesome. You should send her flowers.
Oh, I try to thank her all the time because, and I think the piece of it that people don't really see is how much I probably begged her like for her time and her attention. Like it was like, oh, this is where I want to be. Like I'm going to make sure I attach myself to this woman no matter where she goes or what she does. Like I know this is an avenue for me. So even through pharmacy school or even through undergrad at a completely different school, I was making sure that I was emailing her, and she made sure I had internship opportunities. And then made sure that once I was at UNC in school, that she was there to make sure that I had all the resources that I needed. So you can't put a price on mentorship and just sponsorship to make sure that you have all the resources that are.
Nice. So I also would love for us to get into, how did you now pivot to marketing? Because that was interesting when you shared that part. And I was like, oh, wow, like I didn't realize that those two things could go together. So kind of what sparked your interest and how did you get involved in marketing?
Yeah. So I think that's the other thing is like a pharmacist in marketing. What do you do? My parents are always still really very confused as to how I ended up in marketing. Like you're a pharmacist, like shouldn't you be like CVS or Walgreens? So I'd love to preface it with no matter where you are, once you make the oath to take care of patients, whether again pharmacist, MD, DO, PA, PT, it's always about the patient. And one of the things that I recognized early on doing my postdoctoral fellowship was that, I could go anywhere with a science background, even more so having a clinical background and understanding what it's like to really, so I'm in diabetes marketing, but to have been on the other side of it. So I worked for CVS for 6 years. I worked as part of my clinicals in a diabetes clinic. So literally prescribing to patients, literally changing their insulins. So really understanding the patients and what they go through and how they go through it, which a lot of people don't have that perspective. So I bring a very unique perspective to marketing, whereas this field is typically very commercial, very business oriented. And I come in with like, hey, let's talk about the science and let's make sure we're putting the patient at the very center of this. I don't think we should really go about it this way. People aren't going to look at it this way. When we're thinking about how do we educate and increase awareness for HCPs or healthcare professionals, my focus is on pharmacists. So what better person to be able to make sure we're creating resources that educate and increase awareness for pharmacists than a pharmacist. So I have that unique value that I bring to my team with a perspective that they don't have. And I think that's how you add value, is being able to look at things through a different lens, provide solution, and that diversity of thought is very necessary in order to make sure you're reaching your target patient audience, and just your audience, to make sure that the patient is really at the center of what we do.
Awesome. That is, you have made kind of a unique place for yourself. And you've obviously identified where you have created a niche, and the intersectionality of your talents and your expertise. I'm curious, what types of hurdles and obstacles have been in the way, kind of coming from a very pure, science background and kind of entering this field that blends business and, medicine. What are the types of hurdles that you've had to kind of overcome crossing into that field?
Yeah, that's such a multifaceted question. And because it looks so different when you think about hurdles, they're not always things that you can see. Sometimes you walk right into it and didn't even know you were supposed to jump. So I guess when I think about, making the transition and coming from, and I hate to take it like so broad or general, but I kind of go back and attribute it to being, I'm a Black woman in a predominantly majority white space. And it's not a hindrance. It's not something that, takes away, but it's something that I add value to. But still, in that fact, it can be a hurdle when you are seen as someone that doesn't fit in, and not trying to be put into a box. I'm really big on like, don't limit me. don't put me in a box for what I can do. Yes, I am a pharmacist by training, but that doesn't mean I can't talk business. Just because I'm in commercial now and in marketing doesn't mean that I can't get down and dirty in the science and look at clinical trials. And let's talk about the significance of, the p-value here and like what it actually means clinically. So I hate when people will say, oh, you're limited here, or you've made a niche and you can't move and you can't like think beyond. We tend to put ourselves in boxes, but really there's no box that can limit you to what you want to do and how you aspire to be there. And really, I think the challenge is we don't have enough people really willing to step outside of the comfort zone of what we see, to dream big enough to know that there's more. And so I think that's the biggest challenge and hurdle is that for me, there is not a single Black woman who is a CEO for a Fortune 500 pharma company or biotech company. We have one Black male and there are 2 women, but there's not a single Black woman. Why not? What is limiting us from achieving this, this level of CEO to CEO? I don't think there is anything that's stopping us except for probably our own selves. We deal with imposter syndrome and, stifled authenticity when it comes to, do we have what it takes? Half the time, nobody knows what it takes to actually achieve something. They just do it. And so I want more people to just do it. And so I think that's the biggest hurdle in being in a space where I'm not a traditional, marketer. The biggest hurdle is saying, hey, don't put me in a box. Don't limit me. I can do whatever I set my mind to. And I know I can achieve it because I've achieved things before.
Awesome.
Oh, wow. Yeah, that's amazing advice. And you sound like you're very confident and sure of yourself, which is amazing. But I also would just like to ask, like, is there anything that you know now that you wish you would have known in college that maybe could have helped your career path at all?
It's probably that confidence piece. I can naturally say that, because my parents were super supportive and I just have a really strong support system. And again, like identifying a mentor that believed in me from the beginning. I would have to say, really, it's like, people believe in you, but you sometimes don't believe in yourself, right? And a lot of times the things that I suffered for were really more of just me, like in my own head and my own doubts. And a piece of advice that I got during my fellowship year that I wished I'd gotten earlier on in my collegiate career, and even just earlier on in life was, most people think that you have to go from A to B to C to D in order to achieve anything. And it's got to be a linear path. Not everyone's path looks the same. Your journey is your journey that's for you, that God has for you. And like, no one can take that from you. Whatever is for you is for you. And to follow that is like, jump from A to D. And don't be afraid of that dark space of that you don't know. Because if you do it, you will learn more in that 6-month time period of jumping from A to D than if you jump from A to B. You're going to be more uncomfortable. It's going to be a higher learning curve. But when you do it and you achieve it, you'll be so much further than if you just jumped in that one linear path. So don't be afraid to take risk, not knowing what the path looks like, and trusting yourself to pick yourself up. I really wish I knew that earlier. I failed at something for the first time at 23. And the piece of advice that shocked me was my best friend, who has been my best friend since middle school. She was like, Chelsea, everybody else failed in like middle and high school. You didn't. So you're just late to the party. You'll be okay. Everybody gets through it. And it was like, yo, I had no idea. I didn't know I was missing out on this. So lessons learned, but making the jump. And not being afraid of it, I would have done a lot more, a lot sooner, I think.
Awesome. I think that's a lesson that a lot of folks actually talk to my sister about this a lot. I think, we're in different kind of generations. I'm an elder millennial. She's like a younger one. So, but we talk about that. We talk about how, some folks, if you don't encounter that those hurdles or those obstacles earlier on. When you encounter them later, you're like, am I a complete failure in life?
Yeah.
Something around me, I'm going to go bury myself in a hole. So
stick my head in the ground.
you got mentors, which I think are insanely valuable. And I want to go back to one point that you made, and that was that you like attached yourself to this woman. And I think that that's something that young people maybe are too prideful or something to do. They don't realize that you, by fire, you can force yourself on people.
What? Can you stick on them like white on rice?
Yes, you can just say, listen, I need you to be my mentor. Like, I want to be like you. So, and honestly, over time, there's not many people that doesn't flatter and that doesn't just wear down and then they, end up mentoring you. So I just wanted to go back to that tip.
Absolutely. I wholeheartedly agree.
Yeah. So I did want to ask you though, again, you're a pharmacist and now you're working more in like a marketing role, but I know that a lot of folks, probably a lot of young people watching this, when they think of pharmacists, they think of, when they go to CVS, it's the person that someone says, do you want to ask the pharmacist some questions? And they say no. And so they never even talk to them. Right? And so,
that is me. I'm okay to say that I was very confused. And I was like, so is somebody a pharmacist if they don't work at CVS? And then my sister had to explain to me, you're a pharmacist all the time. And I was like, oh, okay, that's why this platform is helpful.
That's so helpful because I think some of our, our viewers and, some young people, maybe have some misconceptions. So I just wanted to give you the chance to talk about, what the path to gaining a PharmD is, what it is not, and maybe some of the other types of career like arenas that folks end up in, and maybe what your dream role is, where you would like to see yourself in a few years.
Yeah. It's a really good question because, like I said, up until like I was 16, I was like, okay, I guess I'm gonna be a physician. My dad had ordained it. Each of us was going to be something different based off of like our childhood. So I was born premature. I was born 8 weeks early. So I was going to be a pediatrician because of it. My middle brother is blind. We both can't see, but he was going to be our optometrist, and my youngest brother was going to be a dentist because he lost his teeth very, very early. So those were each of our like roles. And so for a long time, it was like, I guess I'm going to be a pediatrician. Or only realized that, my only idea of a doctor was a physician. So I was limited to that purview because that was the only thing I was exposed to. And so Project C, like I said, showed me that doctor comes in a lot of different forms. Even as a PharmD, I'm often mistaken when people refer to me as Dr. Sumner and they're like, how are you doctor? And it's like, no, I'm a doctorate of pharmacy. And I have a 4-year clinical degree as if I'd gone to med school. So kind of that pathway, what it really looks like. And it's different depending on where you want to go to pharmacy school, but it can be a 6-year program. So there are people who come right out of high school and go into a 6-year program where they do kind of pre-clinicals or their prerequisites for pharmacy in 2 years. And then the last 4 years of their schooling is the PharmD curriculum. So you can become a pharmacist at the age of 24 or younger, just depending on how quickly you go to school. So I have a lot of classmates who literally were straight out of high school, did 2 years of undergrad, and then straight into pharmacy school. It's really based off of those prerequisites that you need so you can do them as fast. I know a lot of programs now in high school allow you to do collegiate credit. So there's a chance that you could literally finish your, those prerequisites that you need and go straight in to do the PharmD. And so there are some people who graduate with their PharmDs and aren't legal to drink, and that is okay. It's the pathway is, yours. I, on the other hand, I knew that I wanted a degree to be able to fall back on. So I did not want to just go straight into pharmacy school, get there and find out that I didn't like it. Like I said, I knew I had the experience and have been working in it, but it's different once you're in the program and really need to determine whether like this is the career path that you want to take. So clinical research was something, as I said, I knew that I was interested in. I know that people always are like uncomfortable going and being involved in clinical trials with what's happened to us and the Tuskegee experiments, like Henrietta Lacks. There's so many factors and components for us not being involved in clinical trials. And that's an area for me that I knew I wanted to make a difference in. So having that degree in clinical research, I worked for a clinical research organization, or a CRO, for 8 months. Prior to going into pharmacy school, and loved it. So I was like, hey, this pharmacy thing doesn't work out, I've got a backup option. And I'm all about having options. So being able to move just in case things don't work out, having a backup plan, I'm pretty strategic and wanting to always make sure I can maneuver or pivot if necessary. So I got the 4-year degree just to, have as a backup in case pharmacy didn't work out. But most pharmacy programs are 4 years. Your first year is usually like the prerequisites of just learning the basics of pharmacy and just making sure everyone is on the same page. Your second year, I was in a program that was a little bit different. So our curriculum was very, very accelerated. We spent a lot of time actually doing our hands-on training. So during my second year, I started going in clinicals, and that meant rounding with the physicians, making recommendations as a second-year pharmacy student. And I did that through my second and third years. And I'm talking about, I'm not even joking, the residents. So after you finish med school, usually do a 2 to 3 year residency. So I'd literally be on rounds with the second year resident who's coming to me like, hey, this patient has, pneumonia. What drug am I giving them for how long and what route of administration? Are there any contraindications based off the medicine that they have? And I'm talking, I'm a second year student, like, okay, let's do this. And it was an awesome experience because, I really saw how much my teams valued my input, even being a student, and really got a chance to be involved in the direct patient care. And I think a lot of people just don't know that pharmacists do that. We are drug or medication experts, and that's literally what we were trained to do. So I did that my second and third years. I did international research on diabetes and TB in South Africa. I worked at a pharmacy consult clinic within our dental school clinic. So as dental school students saw patients and in their clinic, I would go around and help the dental students like, hey, this patient is on this blood thinner. So be careful if you have to do any extractions, or we need to pull their blood thinner before you actually provide dental care for them, so that they don't bleed excessively. Making care about, most people don't realize this, but your diabetes has a lot of effect on your oral health. So for patients who have diabetes, it's very important that you are making sure that their medications and their blood sugar is not too high or too low for you to be able to give them dental care. Another big thing that I think people don't really know about is that in dental care, your blood pressure can't be too high, or else you can't get dental care. So we would also often go through and check or make sure that their patient's blood pressure wasn't high before they were getting service. So I had a lot of unique experiences, both in like very clinical settings in a hospital, in outpatient settings where you typically don't even see pharmacists, or you're like, oh, I just go pick up my medication, where I was the point of contact where, for example, another opportunity that you can do as a pharmacist is an ambulatory care pharmacist. And I worked in a pain clinic. And so patients who are on narcotics would come in, and instead of seeing the anesthesiologist, they would see me or the pharmacist. And so I would go through, do their whole physical exam, check their medications and see how they were taking them. If I needed to adjust them, I'd make the recommendation to adjust them, give it to my pharmacist who would sign off on their medication. And I even had the opportunity for it to turn full circle. As I mentioned, I worked at CVS, so I did do the more traditional pharmacy. And a patient that I saw in clinic actually came in and had their prescription filled. So it was like a really full circle moment for me to see, hey, I made this recommendation that we were going to change their therapy. We changed it, gave them the prescription, and then I filled it. So, and then counseled them on that medication. So just in the journey of pharmacy, you spend your last year of pharmacy school doing nothing but clinical experiences to really prepare you to go out into the world and be a pharmacist. And so the RPH behind my name means registered pharmacist. So I technically can practice as a pharmacist in a Walgreens, CVS, or a hospital, but that typically is a more traditional training. So after graduating pharmacy school, most people will go into a couple different tracks. Most people are more familiar with the community setting, which is your Walgreens, your Rite Aid. And so most pharmacists there will verify medications, but they also do medication therapy management, where they'll take a look at if a patient is on 12 medications, and they'll say, hey, you know, this is the duplicative therapy. You don't need to be on this medication, or we need to provide education around your diabetes and like preventative measures to making sure that you're eating right and getting the amount of exercise that you need a week. So a lot of patient counseling. But one thing that most people don't see is that pharmacists are typically on every team in the hospital. So some of the more specialized rotations that I had, I worked in the oncology pharmacy. I rounded with the oncology team. I got a chance to round with our cardio teams in the ICU, which was a crazy experience. Also got to work in our family medicine inpatient and outpatient units. So that was a really cool experience. So, you know, you can do a PGY1 or a pharmacy residency year 1 or a pharmacy residency year 2 that can be specialized. So if you want to go into oncology, that's a specialization. So you need to do 2 years of residency, cardiology, infectious disease. So all of these are just different areas that you can go into a more clinical. You have health system pharmacists who focus more on the operations of the administration side of pharmacy. And then you've got people like me who are interested in the pharma industry. And I always tell students, you know, hey, how do you have a pharma company without a pharmacist? And I just happened to work for Eli Lilly and Company, where Colonel Eli Lilly was a pharmacist. And so that was always like my reason, like, hey, here you go. This is what you can do as a pharmacist. Start a pharmaceutical company. So those are just some of those different areas. Compounding pharmacies, like you can actually make drugs and do research from that way too. But just some of the different options as a pharmacist.
Thank you.
Well, that is a lot of options. And I, for one, have learned a lot from you just kind of sharing the different avenues and even sharing that pharmacists are on all these different teams. Like that is definitely something that I had no insight into. So I really appreciate you joining us today and sharing a little bit about your background, and then also just shedding some light on all the possibilities that are there for somebody who gets a PharmD. So thank you so much, Chelsea. We've enjoyed having you. You were awesome. And don't forget to like, subscribe, and follow us on Instagram at STEM Sisters. And we will see you guys in our next video. Take care, guys.
Bye.
Thanks.
Bye.